Well, the doctor is in, and today it is pediatrician Dr. Courtney Sauls from Ascension St. John Pediatric and Adolescent Medicine. Today, we're going to talk about ways to prevent sports injuries.
Yeah, hi, thanks.
Yes, so we know kids playing all these different activities, back to school. What are some ways that they can work to stay safe?
Yeah, so the most common injuries that kids are going to get right now are going to be your ankles, knees, hamstrings, concussions for your football players. So I've got a couple of tips that kids can do.
Enlighten us.
Yes, so a couple of things before the game or on your free time. Make sure that you're stretching really good before a game and after a game. And then make sure that you're getting enough hydration, drinking a lot of water.
And why is this important?
Yeah, you got to work those muscles out. You don't want them to be stiff. You're more prone for injuries if your muscles are really stiff and not given enough stretching. And then you want your body to get a chance to rest. So if you're playing an intense sport, especially through your school or a club, make sure you're giving some time to rest. So a day, a week, at least that, and make sure you're taking some off-season time as well, which doesn't really apply to the fall, but make sure you're taking some off-season and not just going hard every day. And then a couple of things to do during the games, make sure that you're wearing your proper gear. So especially your...
And especially like, I'm sure, I know like helmets is always a big thing. Is that something?
Yeah, so in football, obviously wearing all of your appropriate padding and your helmets. Also in baseball too, you can get, balls to the head, so make sure you're wearing that appropriate helmeting gear, and then soccer, your shin guards, those types of things. And then also making sure you're adhering to the rules. So especially things like football, they have those rules in place for a reason, especially to prevent head injuries. So making sure that you're not targeting, chop blocking, those types of things in football to really protect the head from concussion. So those are some really big things that kids can do.
Love that. And for parents, that may be wondering, does my kid have an injury? What are some things that parents can even look out for as well?
Yeah, so you don't want your kid to push through the pain. So if they're really saying that they hurt or they're having a headache or they're limping, you don't want them to keep playing through a game. Have them sit out, and then if they're still hurting after they get home over the next couple of days, have them come see their pediatrician. We can assess them in the office.
And when they come in, what are some things you all are able to assess? Why is it important to potentially go to a doctor if, your injury is that severe?
Yeah, most of the time it's going to be a more simple injury like a sprain or a tendon injury, but there could also be fractures too. So you don't want to have like intense bone pain where you push on a bone and it really hurts. Or if a child's not able to limp or walk, we're going to be able to assess where they need to go next. Maybe they just need some rest or some stuff they can do at home, or maybe they need to get an x-ray or maybe even see an orthopedic specialist. So we'll be able to help guide them on whatever they need to do.
Perfect. Thank you so much, Dr. Courtney Sauls.
Thank you.